As you can imagine, communicating with someone in a period of psychosis can be challenging, to say the least. With patients who are in the manic phase of their bipolar, you may have experienced this yourself, but they can talk so fast and their speech be so disorganized, that flight of ideas where no two sentences are related to each other, that you ask a question and they start to answer it, but then they're off in left field talking about something entirely different. And in those cases, you have to work very hard and frequently to try and refocus the patient by saying their name to get their attention and asking more closed-ended questions. Sometimes with schizophrenics, bipolar, or any other kind of behavioral crisis or psychosis, the patient may just flat out refuse to talk to you. Maybe they don't trust you. That's not uncommon with persons who have delusions of persecution. And they could also become hostile, at which point you've got to ask yourself, is your scene still safe? We'll talk more about that later. Speak softly when trying to communicate with folks in this period of psychosis. Avoid coming off like you're interrogating them as best as possible, and allow them time to answer your questions. If they are slowed down in their mental processes at whatever, you may just have to give a little bit longer pause for them to respond to the questions you're asking. Now, not every one of these situations that we're discussing is true of just communicating with people who have a psychiatric illness. This can also, some of these communication tips that we're going to cover in just a moment, these also apply in cases where the person who is not diagnosed with a mental illness is in the midst of an acute behavioral crisis. Maybe it's a parent that just watched their 7-year-old child get run over by a car and killed. You can imagine how beside themselves they would get. You may have encountered patients in a state like this where they are just acutely out of their minds.
Shut up and listen to me, Grant. Grant, shut up and listen to me. Grant. Okay, are you going to be a coward? Are you? Grant, shut up and listen to me. Grant, shut up and listen to me. Will you do that? Keep your mouth shut. You need to come out of the house so other people can go home. Okay? You need to man up and come outside and take care of your problems. All right? I'm going to stay on this phone all night, and we'll stay out here the whole time. You need to come outside, put the gun down, and take care of business. Okay? Can you do that?
No.
No? So you're just going to be a coward and hide in your house?
Yeah.
That's not going to accomplish anything, is it? What happens when your parents come home tonight? We're not going to let them in the house, but where are they going to go tonight? When they come home? Where are they going to go? Where's your brother going to sleep tonight? Is that right? That they can't be in their own house? Because you're being stubborn and being a coward instead of being enough of a man to come outside? Answer me, Grant.
What?
Are you going to be a coward and stay in the house, or are you going to be a man and come outside and take care of your problems?
In the house.
So you're a coward?
Yeah.
What good does that do? Put the gun down and come outside. Can you do that?
No.
Why not? I told you what's going to happen, didn't I? Yeah, you're going to end up going to a hospital tonight.
And the jail.
Maybe, maybe not. Is that better than dying? Yeah.
You can't even give me a for sure answer on that. Yes
I don't know. There used to be a TV show on called Beretta. And you know what the saying was? If you ain't got the time, don't do the crime. Okay? You have an anger problem. That's obvious. Okay? You're stubborn. That's obvious. But you know something? I'm 10 times more stubborn than you. I'll stay here all night. And I will talk to you until you put that gun down and come outside. We're not going to come inside and confront you. Even if you cap off the round, we're not going to come inside. We're not going to put our cops in danger because you're being stubborn. Think about your parents. Think about your kid brother. That's what you need to think about. Shot fired. Are you there? Are you there?
Okay, well, that was a pretty glaring example of how not to communicate with someone in the midst of a crisis. Now, that audio may seem unbelievable, but that particular police department at the time had a policy to treat suicidal persons as though they were hostage takers. So there was a lack of understanding of behavioral crises and therapeutic communication. I mean, think about what the officer did not say word for word, but what he was nevertheless communicating to Grant. By the way he was interacting with Grant, did he express concern for Grant's well-being? Did Grant feel like the officer cared how he was doing? Did the officer show any empathy for Brett's situation? He wasn't patient with Grant at all. There's just a lot that could be said about that, but the bottom line is that that was a horrible example of how to communicate with someone in crisis. Now, these are just a few tips for communicating with someone that's in crisis. First off, don't argue with them. Don't take the bait if they seem to be trying to egg you on and get you into an argument. Avoid that temptation. Don't take it personally if they are saying things directed toward you in a negative or nasty way. And let the patient vent. Oftentimes, someone who is screaming to the heavens and may seem like someone who has the potential to do something bad, if they're only venting, as long as you got law enforcement there with you, just stand back and let the person vent. In fact, if this sort of thing is happening while you've got them in the back of the ambulance, I would encourage you to even give them permission to be angry or whatever emotion they are feeling. Give them permission to feel it. Validate those feelings. It may be something as simple as saying, I can't imagine what it is to go through this like you are, but I can tell that you're very upset. And if I were in this kind of situation, I'd probably be really upset too. And you'd be amazed how that can de-escalate some otherwise very volatile interactions. If you've got someone that is in crisis, if they're not thinking clearly, you may have to keep your directions and questions very simple and just be patient. Also, don't speak with family in any kind of hushed, secretive manner or any way that can be perceived, real or imagined, any way that could be perceived as secretive. And if I ask you why not, I'm sure most of you, if not all of you, can guess why, especially if the patient has delusions of persecution, or they feel like people are out to get them, or they're going to be hospitalized and committed for the rest of their lives. They may have all kinds of thoughts going, but it's all going to work against you, because one of the most important things about managing these patients and communicating with them is to establish rapport, to build that relationship of trust. It makes a big difference in communicating with them, as well as assessing them, and also ensuring everyone's safety, including your own. If someone is experiencing psychosis, sometimes the behavior could strike us as comical. You know, I talked about the stereotypical person wearing the tinfoil hat. But be cognizant of the fact that they may be a lot more aware of things going on around them than you realize. And you'd be surprised at, once their behavior is stabilized, how much of their encounter with you they can remember. And that could backfire on us as the EMS and fire culture. Now, also, if the patient has that unpredictable factor and could potentially become violent, if they perceive that you're making fun of them, you could just simply be asking for a butt whooping. So be careful about that. Never pretend that you can see or hear those hallucinations. Why not? Well, imagine that the patient says that there's a purple talking dog in the corner of the room and asks you, do you see that? Don't play along with it. Don't say, yeah, I see that too. Why not? Well, because imagine if the patient goes on later to ask you a question about what the hallucination is doing or saying. Then what? You'll have just been caught in a lie, and you'll have lost the patient's trust and maybe sabotaged your chances of ever earning that back. And you need that trust. And remember that even though some of these hallucinations can seem quite comical to us, those perceptions are very real to the patient, perhaps even frightening. Imagine what it must be like not to be able to trust your own eyes. People can do some pretty unpredictable and even dangerous things when they're afraid. And we need to be a source of safety and a means of grounding them back in reality in those times. That's some of the best therapeutic treatment that we can give these patients. So instead of playing along, just calmly and without judgment, just tell them, no, I don't see that, but that must be very frightening for you. There you go. And if the patient is hearing voices, it is a good rule of thumb to find out what those voices are saying. For example, if the voices are commanding the patient to hurt themselves or kill another person, perhaps even you need to know that, especially because you could get caught off guard if you're unaware that those thoughts are going through this person's mind. And just ask them. If they're saying that the voice is telling them to hurt themselves, kill themselves, ask, how would you do it? And then find out if they have the means to carry on this plan. They say they are going to shoot themselves. Well, do they have access to a gun? You know, and ask, are you going to hurt me? Don't shy away from those questions. You're not increasing the likelihood that something bad is going to happen. Instead, you could be taking precautions or have more information to get the patient the extent of treatment that they actually need. I want to take a step back because we're talking about worst case scenario with all of this. We prepare for the worst and hope for the best. The reality is that the vast majority of psychiatric patients are never going to be a threat to you or I. But knowing and predicting just which ones could become dangerous, easier said than done. Even experienced mental health professionals, psychiatrists, they've done studies and shown that they, even with all their experience, they can predict accurately the potential for violence in less than half of those patients that do become violent. So again, just making sure that we're not adding to the stigma of mental illness. I still want you to be prepared and remember that your safety truly does come first. We take that saying for granted, but think about every EMS textbook. What do they tell you to do when a scene becomes unsafe? I'll give you a hint. It's not lay the smack down on their candy ass. That is nowhere in the EMS textbooks. And I've looked. So one thing that you will see amidst all of these quotes here from various textbooks is a common theme, the word retreat, flee to safety. You may have to leave the patient to go someplace where you are safe until law enforcement arrives to subdue and to make the scene safer. Now that can be difficult. And I think there's a mental barrier for a lot of people thinking in terms of, well, this is patient abandonment. I can't leave them. And it's harder when you know for a fact, yeah, they do have a medical problem, a legitimate medical problem occurring here. But that doesn't change the fact that if your well-being is placed in harm's way, your duty to act ends at that moment. For at least that period of time, they are no longer a patient, they are an aggressor. Now, once they've been subdued and rendered safe by law enforcement, then they can quickly return back to being your patient again. And with that, we are going to take a short break.